All right. So good evening, everyone, and welcome to Frontier Nursing University's Institute for Healthcare Improvement Open Chapter Quarterly event. My name is Dr. Kristen Gianellis, and I am the current FNU IHI Open School Chapter Faculty Chair. The focus of these quarterly events are to highlight an area of quality improvement work, generate some interest and enthusiasm, and come together and learn some new things in a low stress environment. So tonight we have a fantastic panel of nurse leaders who will be sharing with us their experiences in legislative actions across the country. As nurses, sometimes we shy away from the health policy arena, favoring direct patient care and one-on-one interaction instead. But as DNP prepared leaders, we are called to be the voice for our patients, their families, our nursing peers, and our profession, always striving for improvement and healthcare change. So before we get started, just a little housekeeping. Please have your microphones muted while the panelists are speaking. If you have a question or a comment, you may place it in the chat box or use their hand raise function. And as we enter into this discussion about health policy, I'm reminded of the tremendous diversity in our community here at Frontier. While we may be from different backgrounds and hold different political values, we are bound together by our shared commitment to caring. And so I encourage us all to approach our time together with respect and collegiality. So without further ado, I'd like to introduce our panelists for this evening. First, we have Dr. Vicki Stone-Gale. Dr. Stone-Gale is a DNP prepared family nurse practitioner with 30 years of experience in primary care. She is an associate professor in the family nurse practitioner program here at Frontier, where she's the course coordinator for Primary Care 1. And she is on a variety of university committees. She also continues to practice part-time as an FNP in Florida. She is double board certified by the ANCC and the AANP and is a fellow of the American Association of Nurse Practitioners and the National Academy of Practice. And she has served in various organizational leadership positions and is currently the president of the South Florida Council of Advanced Practice Nurses and the first vice president of legislation for the Florida Nurse Practitioner Network. Dr. Stone-Gale has been actively involved with nurse practitioner legislation for over 29 years. So thank you for coming today, Dr. Gale. Next up, we have Suzanne Workman, who is a certified nurse midwife. She is the state government affairs consultant for the American College of Nurse-Midwives. She has over 20 years of experience providing midwifery care to people of all ages and backgrounds in public and private and nonprofit settings. Suzanne has spent most of that time also working to advocate for policy change that will mainstream midwifery in the United States. She lives and works in Wilmington, North Carolina. And welcome, Suzanne. So next up, we have Dr. Melanie Bell. Dr. Bell is a published professional registered nurse of 21 years. She received her DNP and healthcare systems leadership from Chamberlain College in 2017. Her career includes work in private healthcare organizations, as a federal contractor and civilian positions with the Department of the Army, and she's a current federal employee. As a nurse consultant with the Health Resources and Services Administration, or HRSA, she oversees awardees receiving federal grants that directly impact FQHCs. In addition, she has, through her primary roles, she remains on the front line of healthcare delivery as an inpatient nurse case manager, mentor, and she serves on several advisory boards. She's an active member of the Maryland Nurses Association and is the current vice president, the chair of the membership committee, and the immediate past chair for the legislative committee. And so thank you, Melanie, for joining us. And finally, we have Katie Page. She is a certified nurse midwife for over 10 years and has been in full scope midwifery practice in Lynchburg, Virginia. She is a legislative chair and immediate past president of the Virginia affiliate of the American College of Nurse-Midwives. In this role, she represents the organization on several state committees and guides the organization's policy priorities and work. She also recently served ACNM as the National Professional Liability Chair, Section Chair that works to understand liability and litigation experience for midwives in the US. Within her institution, she also leads quality improvement. I will say that all 4 of these nurse leaders sent me bios that were much longer than this, and so they are incredibly accomplished. We are so thankful to have them here with us tonight. So let's get started and talk a little bit about health policy. And I'll just remind everybody to make sure that you're muted here. My first question for our panelists is, how did you get involved in health policy work? And I'm going to start first with Dr. Stone Gale.
Thank you, Kristen. And it's so great to be here to see all of these 90 people here tonight. It's wonderful. So I started many years ago in policy, and I was very blessed to have a wonderful mentor. I had been out of school about a year, and I became the president of our local nurse practitioner organization. We had just founded the organization, and we had a lady that was with the Florida Nurses Association. Her name is Barbara Lumpkin, and she did a lot of lobbying for nurses in general in the state, but also she was very instrumental in helping nurse practitioners in Florida get prescriptive privileges, period. Not controlled substance prescriptive privileges, but just in general privileges. And so we invited her to come and speak to our meeting, and she said to me, I really would like you to become involved in lobbying and legislative things in Florida. And I was like, I don't even know what you're talking about. And she said, oh, you will. I would like you to come to Tallahassee and next week and come into the chambers and listen to the legislative ongoings there. And I'll introduce you to some of the legislators and some of their aides, and we'll get you going. And I said, oh, I really don't think so. And she goes, oh no, you'll have a ticket to meet me in Tallahassee next week. So I was like, okay. So I bought my ticket and I went to Tallahassee with Barbara, and I was hooked. That was it. And I have been involved ever since. She was my mentor for so many years. She passed away 3 years ago. And it was a devastating loss to all of us in Florida, but she really guided me along the way. She helped me to be able to listen to the nurse practitioner issues that were at the forefront in front of the legislative committees. She taught me how to speak with legislators and their aides, and how to connect and how to write letters and how to walk the halls of the Capitol. And we walked the halls of the Capitol, and she was the type of person that had so much respect in Tallahassee in the Capitol that she could just talk with anybody, and they would talk to her in the halls, and all the senators would stop and talk to her, and all the representatives in the House would stop and talk to her. And it was like she had an open door into all of their offices. And that helped me get an open door into their offices. And so I spent a lot of time mentoring with her and going into committee meetings, learning how to actually speak about our issues, learning how to address the legislators, learning that the aides are just as important. The workers in their offices are just important as meeting with legislators. In fact, sometimes they are more important. And then we started inviting the legislators to our meetings, and we would have panels of all the senators and the House of Representative people in our community that were, our local legislators. And we started bonding with them and getting to know them and working their campaigns. And so I have spent, all 29 years doing that. And now, I mentor other people to do the same thing. So that's kind of how I got started. I was very lucky.
That's wonderful. I'd love to hear from one of our other panelists, maybe Suzanne.
Thanks, Kristen. Thanks so much for having me. It's funny, I just talked to a bunch of students at the University of Minnesota this afternoon. So I'm like, I feel like I'm an evangelist, and I love what Vicki said, because it's sort of, yeah, like I try to remember when I got involved in this. I would have to say my earliest memory of anything around the political process was there used to be, and I wish there was still something like this. There used to be these little tables for kids when your parents went to vote, and you could pick like George Washington, Abraham Lincoln, Thomas Jefferson. I mean, we all know they're problematic these days, but it was like, oh, the pretend ballot. And I thought, this is so cool. I get to pick people. You get to pick. So even from a small child, I was fascinated by the process and being able to actually have a voice. I attended a women's college, an undergraduate with an undergraduate degree, and wasn't ready to be a nurse midwife at that point, and really got steeped in feminism and social justice. And then once I got to midwifery school, I was at University of Pennsylvania, where you do public policy there or else. It's a big public policy research center, and they kind of brainwashed us, I would say, but no, gently cajoled us into doing this. So it's always been something that I never even thought was an option. And when I hear people say, well, that's not for me, it kind of gets my hackles up, because I have to say, it's like, it's our responsibility as patient advocates, first and foremost, as nurses, to advocate wherever we are. And you might not get the same thrill that Vicki and I have to walk the halls of your state legislature, but should be doing something. So I think that's, if there was like one message that you took away from this, there's something that everybody can do. And it's part of your professional responsibility as a patient advocate to be involved in health policy, and it's fun. So there you go.
Thank you. That's wonderful. And I see other people. I saw Katie nodding her head when she said it gets her hackles up when people do not think that this is for them. Katie, why don't you tell us a little bit about how you got started in health policy work?
Yeah, for sure. Thanks for inviting me. I've been trying similarly to think like, when did it begin? Growing up, I'm from a small town in North Texas, and was involved in community organizations there, and and when I went to a women's college as well. When I came to school, wanted to bring the it was a youth related. I can't even think of it worked with the Chamber of Commerce, but it was a youth Chamber of Commerce program. And wanted to bring that program to my community here, and so I have always been interested in the workings and the organization of everything. I also tend to be a rule adjuster, and so part of successfully being able to adjust and create rules is understanding the people and the reasons and the context for how those systems and rules came to be, and so for me the evolving into specific and direct policy and law creation and advocacy has just been a natural extension of that. I don't necessarily, I also share Suzanne's conviction and mandate that this is a professional obligation, but not necessarily from a patient advocate standpoint. I mean, certainly, because that's who we serve, but I see it a little bit more self-serving, I suppose, that this is how we are literally able to do anything. The way that we're able to be licensed to practice, the way that we're able to work within our health systems, the way we're able to work within our communities is completely dependent on the rules that are written at the state level, at the institutional level, at your practice level, at your community level. And so it exists in all of these spheres. And so to understand that, to say you're not participating in that is just to miss that interconnectedness of and how all of these things influence each other. So I guess one of my direct ways and how did I get involved in midwifery advocacy was Denise Coulter Smith, when she used to live in Virginia, and we were at one of the ACNM annual meetings, and she and I knew of each other and had met casually and were friendly, and we passed each other in the hallway, and she said, "Oh, Katie, come back. I'm leaving Virginia. We need someone to become the government affairs committee rep for our region, and you should do it." And I said, "What are you talking about? What's that do?" And she's like, "Oh, it's nothing. You just attend some meetings, and you'll connect with the state reps about laws, and just be a relation person to the national GAC." Well, I guess I can do that, which is not at all what the job was. So that's how I directly became involved and intimately involved with government affairs work and policy for midwifery.
Thank you so
I just
much.
jump in and say something too about what Katie said. No one's coming to help us. No one is coming to save us. Don't throw away your power. That's it too. Okay.
Mm-hmm.
Well, thank you. So I actually want to hear now from Dr. Bell, because if anyone's helping us get things done, it's Dr. Bell right now with her federal and national policy work. So Dr. Bell, how'd you get involved in policy work?
Sure. So actually, and good evening, everyone. It's a pleasure to be here, and thank you for the invitation, Dr. Janellis and Dr. Sherman. So I got involved during my master's program. I went in to be a nurse executive. I was going to go in and make changes from the top. And about 2 classes in, I decided, you know what, there's some issues at the foundation. So what about health policy? So I looked into health policy. I often thought, who writes these policies? Who writes these laws that we're governed by? Especially with healthcare, are they people who've never touched healthcare before? Or are they people who haven't worked the bedside in 30 years? And so I switched to healthcare policy. I did an assignment with the National Guard where I worked to try to change the way soldiers did exercise, sleep, and nutrition to better themselves. And after finishing my DNP, I met my state delegate. She came to a nursing event. And she basically took me under her wing and introduced me to the Maryland General Assembly. So I participated in the Legislative Black Caucus events throughout the summer, where we kind of just developed some policies for the community. And my excitement grew more and more. So it started in the master's program, and it's just continued since then. So.
Thank you so much. My next question sort of piggybacks off of this. And I originally was going to ask my panelists to tell me what legislative actions they've been involved in. But then I realized that we'd be here for the next 6 hours. And so I'm going to ask you all to tell me maybe the one that stands out to you, and more so what your role was. So I don't know who wants to start us off first. You only get to pick one, sorry, because we'll be here all night otherwise.
I'm happy to begin. Mine's fresh.
Great, sounds good.
I'm really excited. Virginia became one of the 8th state in the country to license certified midwives. That bill was passed last legislative session, and we became now I'm forgetting the state number 28th maybe to give autonomous licensure for certified nurse midwives. And so we had, this was in 2021, so last year, we introduced two bills. Our full practice authority bill for certified nurse midwives was a single House bill, and then our certified midwife licensure bill was actually two bills because we'd introduced one in the House and in the Senate for companions. So my role at the time, I was president of the association and had been working with a task force of certified midwives and certified nurse midwives in the state for the previous 18 months to talk with potential supporters, to talk with people who we anticipated would be opposition to the particular bill, to understand concerns that they had, to hopefully build a strong coalition of support so there wouldn't be opposition to either bill. And we worked to craft the language for the bill. And then myself and Karen Kelly and Mary Ellen Bouchard and Nicole Wardlaw, who were our leadership team at the time, worked together to communicate with our members, to communicate with members of the community, to create social media posts, to create videos, to create how-tos. So it was a lot of instruction of giving people the tools, both midwives and our clients and other people and other birth workers who would support the bill, give them talking points to call their legislators, give them the phone numbers to call their legislators, giving them email templates to email their legislators, recruiting people to give testimony in committees. This was the truly remarkable, well, a couple of things that were really remarkable about our bills is that last legislative session was entirely virtual. And so we were doing all of our advocacy through Zoom or through phone or through email, mostly through email. We were able to have two bills that moved from introduction to passage in one session. We are the only advanced practice providers to have, well, we're not the only to have a pathway to supervision. We have the lowest transition to practice in Virginia for autonomous practice of advanced practice providers. We were able to introduce a new class of licensure status in the state and have that bill successful in 1 year. And my most favorite fun fact is we were the second most talked about bill in session last year. And the most talked about was a bill to legalize marijuana.
Wow. Okay. So really getting midwives to be, getting any nursing action to be the second most talked about bill in an entire state for an entire year is phenomenal. Amazing.
Yeah.
Who else wants to share?
I'm still really just tickled for that. No, I was just going to say we are still celebrating and now moving into the implementation of both of those bills, but it was really special.
Excellent.
I can go next.
Yeah. Great. That'd be great. Thank you.
So if anybody knows anything about Florida, they know that our political arena down here is really, really bad with the Florida Medical Association. And it's just been a battle for anything that we want. They don't want to give us anything. And so we have really been trying to get some type of full practice authority or autonomous practice or independent practice or anything that we could for all of the nurse practitioners down here. So we have fought this battle for a long, long time. I mean, every year our bill doesn't get heard, our bill doesn't get heard. Well, finally, we were able to find a sponsor in the House who is a physician, Carrie Pigman, and then we were able to befriend the Speaker of the House, Jose Oliva, and they really went to bat for us to get some autonomous practice privileges passed in Florida in 2020. So we really did a lot of work with those two legislators, and they did a lot of work with the other legislators to get them to vote for us. And so what happened is in January, there were probably, I'd say, close to 100 nurse practitioners that descended on the Capitol in January, and in 2 different sessions we did this. And what we did as the legislators were coming into session is we lined the halls with all white coats, standing there with all of our autonomous practice and our House bills, and we had all of our things there. And so we all went into, we were able to go into chambers, and we had permission from the Speaker of the House, which is highly unheard of, to be able to allow all the nurse practitioners that were there to actually sit up in chambers, up in the upper level of chambers. And we were recognized by the Speaker and got a standing ovation from all of the House of Representatives. So during that time, Speaker Oliva said he would like to, they always have Doctor of the Day in the Legislative Capitol clinic. They've never had a nurse practitioner or to be in that clinic ever. It was always the Doctor of the Day. So Speaker Oliva said, well, you know, this year we're changing that. We need a nurse practitioner to be in the clinic. So Dr. Doreen Casarino, who is involved with AANP, she was the first nurse practitioner of the day, and then I was the second nurse practitioner of the day to be in the legislative clinic. And we actually saw people who were sick and needed to be seen, you know, they need to be seen and everything. But then we were both brought into the Capitol House session, and were on 2 different days. So both of the days that we were, Doreen did it one week, I did it the next week. And then we were recognized again on the House floor by Speaker Oliva for being the nurse practitioner of the day, and got standing ovations again from the whole House. So, you know, the political arena down here is that what the governor wants, the governor gets. And that's with any governor. It's not just our standing governor, but it's with any governor. And so they play these political games. Well, I'll give you this, but you're going to give me this. So the word on the street was, if you want anything to be passed in the House this year, then you will give our primary care nurse practitioners autonomous practice. And so we were not 100% happy with the bill at all. It was only inclusive of primary care nurse practitioners practicing in family practice, practicing in general internal medicine, or primary care peds. And the midwives were inclusive in that, but they had to have a transfer agreement with the hospital. Well, you know, they already have emergency things in place as midwives, so they didn't even have transfer agreements. There is not any such thing, and they have a bill in right now to negate that whole part of the bill. So we ended up getting passed with those specifications of what was in that bill. Like I said, it excluded some of our nurse practitioner groups, but we're working on going back in there. But we had our bill passed. So we did get autonomous practice for the family nurse practitioners, the primary peds, and general internal medicine, which was an unbelievably huge feat. And we knew this was the only year that we could do it because Speaker Oliva and House of Representative Dr. Carrie Pigman were termed out, and they would be gone. So all of our support would have been gone. So we really knew we had to take what we could get, and we just took what we could get with the idea that we knew we could go back in and clean up something and, you know, try to get this bill cleaned up. So I was so proud to be the first autonomous nurse practitioner licensed in Florida. And my daughter's a nurse practitioner. She was the second nurse practitioner to get licensed autonomously in Florida. So that was like, I think that was probably the high point, because we had worked so hard for that for so many years, and we have so much to do yet to get other nurse practitioners on board with that autonomous practice. But we know we have our foot in the door, but it's really going to be tough moving forward. We're having a big fight again. So
that's fantastic to hear about. Dr. Bell, tell us a little bit about your favorite action policy. I'm sure you have many.
Yes. Up until yesterday, I had a real favorite. I testified yesterday and it came out, my testimony came out immediately in the paper. So your words matter. And that was on a Medicaid bill. But my most memorable bill that I testified on was preventing pelvic and rectal exams on unconscious patients. And I did this in 2019 and it was on my birthday at that. And so it was huge. I just couldn't believe that people were actually doing this to patients. And a lot of times it would be med students, say if they needed to be signed off on a pelvic or rectal exam, patients in ICU, patient is unconscious, they go ahead and do it and get signed off. And a lot of students felt uncomfortable doing this. And so the testimony went very well. I previously served as the nurse for the Miss America pageant. And so Miss Maryland came and joined me and I invited her to just listen in, and the chair of the committee actually asked her, did she want to say a few words based on the testimony? And so following the testimony, the next day it made it to the Capitol Gazette for Maryland. The Associated Press picked it up and published an article. And honestly, I didn't even know what the Associated Press was until I got an email from my lobbyist saying, congratulations. And so I'm like, wow, I didn't realize that so many people listen in. Then the doctor's television show actually picked it up and invited me to come and speak as a patient advocate, but I got the message too late. And so I wasn't able to go, in the law firm in DC picked it up as well. So that was a huge turnout for testimony, and it was my first time. So I was very proud of that moment. And, like you mentioned the doctor of the day, Vicki mentioned the doctor of the day. I think too that we should have nurse practitioner of the day. I've asked my senators, who I'm very close with, can we change the House and in the Senate to be inclusive of nurses? So I can share sentiments with all of you and all the stories that you've shared. So.
Thank you so much. And such an important bill. The fact that that has been going on, pelvic and rectal exams on unconscious patients, individuals, is just a horrifying part of our medical history in this country. Suzanne, I'd love to hear from you about your favorite or most memorable legislative action.
Oh man, I mean, I was just like, yep. All three of the speakers before me, I can say, I've followed those things, some more closely than others. Florida had a bill very similar to have, but it got a twist where patients have to give consent before a pelvic exam, and because there was a physician doing. Anyway, I digress. I will say the most important thing, or the most, I work with every state, so it's hard for me to pick out just one, but I will tell you the first time that I was really intimately involved in the passage of legislation was when I was living and working in St. Thomas in the U.S. Virgin Islands, and we did not have prescriptive authority. So, and no APRNs had prescriptive authority at the time, and this is not that long ago. And so we worked together as a coalition. It was great. It was the first time I really felt, because I'd heard all of the stories in midwifery school, and as a nurse midwife practicing in California, that, like there was this weird thing between nurse practitioners and nurse midwives and nurses and midwives, blah, blah, blah. And I thought, oh gosh, how are we going to get this done? But we actually all came together, a group of us, nurse practitioners and nurse midwives, to get prescriptive authority. Because so I would be at the clinic and have to call in every prescription for a patient under the doctor that I worked with. Like that was our workaround. And luckily, the island's small, and everybody's working for the government mostly, but it's just a pain in the butt. And it's not, you're not practicing under your own name. You're putting prescriptions underneath somebody else's name. They're not checking up. It's not a good way to practice. So we were really lucky the way the Virgin Islands works, they have senators, so it's just one house. And we knew people, we knew a senator, and so the benefit of doing it, and I would say like anybody in a small state, it can be sometimes really pretty easy to get legislation through because you don't have a lot of people that you have to talk to. And usually, I mean, in the work that we do, somebody always knows somebody. You may take care of someone's relative, you may take care of a legislator yourself, and they may, be able to help. So we had a terrific champion, and it took probably about 8 months of working. I worked with a Frontier grad on a lot of the work, and we became fast friends. And it was a really great day when the legislation passed. It was probably the easiest legislation besides Virginia to get passed, or maybe I should say quickest. I don't know if Virginia would qualify as easy. So yeah,
I don't think that was easy.
no. I wanted to jump in as you were telling the story and just say but I don't want to scare anybody. They did a lot of work. They were tireless.
It was a lot. Well, the most surprising and I learned so much. It was a complete crash course, and we had a really fantastic lobbyist. And I'll say the one thing that was the most shocking was that in the Senate anyway, the bill, which was our final place to get voted through, the bill passed by 2 votes at the beginning of session, and we're like on a high and celebrating in all our respective places, and yay. And at the end of the session, they called the bill back because there's this process of recall that if they don't like the outcome, they can bring a bill back to the floor and erase all the votes and make you vote on it again. And so they had to vote on it again, and we won by 1 vote. So it was just like, it was amazing. So I don't know. That was my most curious.
That's fantastic. It really is. And it's great to see the joy that all of you have in your legislative work. It's really, I'm seeing lots of comments from people like, this is so inspiring, this is so wonderful. Because this is our IHI event, we work with the Institute for Healthcare Improvement Models for Quality Improvement. I'd like to hear how you all would relate health policy work. How do you link it with healthcare quality improvement? How do we make that leap? And I think you've all spoken about that, but how do we make that leap between what students are doing right now in their sites, QI work in their sites, and policy work perhaps after graduation? Suzanne, yes.
I know I just spoke, but I've got one. Yeah, totally on this. So we work closely, and I see Diana Jollis, brilliant researcher that helps me do my job because she makes good stuff happen. I feel like we have it's so interconnected. It's hard to even say where quality starts and where policy development begins. And I forget who said it, when there's a problem, we have a problem and we need to fix it. The only way we know that there's a problem is because we're always assessing how outcomes and things. And I know for us, in midwifery, we work on something called AIM, which is, I never remember the initials, but it's a quality improvement. For those of you who are nurse midwives on here, you know what I'm talking about. It's a collection of practice bundles that basically help folks, mostly in the hospital, but they're starting to branch out into outpatient care. But giving people a checklist, of measurable things to do to prevent things like, the morbidity and mortality around postpartum hemorrhage, for example. And so those folks who are doing that work at the state level, what I've been trying to do is get them to understand, yeah, that's great. You guys are researchers, you guys are academic people, but you're the same people that are going to sit at the table and make the decisions. And we need you to understand the political process too. Many times the organized medicine has a little bit of an advantage over us in that they've got those same people at the tables. And so I think that it's really important and integral. Like, we can't do one without the other. Like, I can't make a case for changing, or I love what Katie said about rule adjusting. I can't adjust a rule or a law if I don't have data. And if I don't have, the triple aim, that's my go-to for everything that we do, my rationale for everything that we do in the political realm. Thank you, Kathy. Alliance for Innovation in Maternity Care. Yes.
Excellent. Thank you. Dr. Bell, I think you were getting ready to speak. Yes.
Yeah, so I was going to say, with the right policies in place, the quality of healthcare delivery improves tremendously, right? Because there are standards that clinicians must adhere to in providing optimal patient care. And so using what you're doing in practice and putting that into an implementation in the community, getting involved with your state, since you all already nurses, being involved with your state nurses association and being involved with the American Nurses Association, that gives you the opportunity to get down and do grassroots types of involvement and just bringing awareness, bringing these issues up in your current workplace, looking at your current workplace and seeing what challenges there are and how you can help to improve it. When you're working on your DNP, you're doing a project. And so basically you're looking at how can you change practice, and is it sustainable, and is it feasible for the environment that you want? So just think big and don't limit yourself, and always think quality over quantity when it comes to healthcare delivery.
Thank you so much. I am furiously typing in here saying, PC 744 students, please think about your sustainability. And of course, our PC 740 students, look into these bundles. This is what makes a QI project.
And talk to your quality improvement department. That if you're working in a hospital, you have quality nurses.
Oh, that's so key.
Yeah. Sorry, Katie.
No, I was going to say, no, that's such a big deal, because I was doing QI work on reducing primary cesarean in our hospital for a year and a half before I got connected with our QI department to even know that we had one, and the analysts were so instrumental. I think about, if you think about the process of quality improvement, rapid cycles of change. When it comes to anything policy or guideline change, it's not rapid, but the concepts are the same. So you recognize a problem, you think about possible solutions, you develop a process for that, you test your process, and if it works, you continue with it. If it doesn't, you make some tweaks and change the language and involve more people, change your stakeholders, and you apply it again. And so the same you apply those same concepts if you're talking about improving workflow in your clinic, which is policy. If you're looking at hospital bylaws changes, if you're talking about practice guidelines, if you're talking about institutional based policies, you're applying those same methods, because none of these things happen in silo. Particularly in institutional setting, you are having to go through your immediate supervisors, your immediate teammates or colleagues, and then you're going to take that to your immediate supervisors, and then it's going to go through the department, and then it's going to go through the next committee and the next committee. And so each of those steps is essentially a new cycle if you will. And then when you translate that at the state level to laws, you're doing the same thing. And so I love the encouragement and the advice to dream big. And I'm going to encourage you to dream big, but look local, because to make change and to be a policy influencer, that doesn't mean everybody's writing new laws and working in your state at your state government. It means looking in your practice. It means looking in your institution. It means looking in your community. And so that's part of what I mean when I talk about our work in policy as a professional imperative, because it is all around us. You can't practice without caring about policy.
And I'll just kind of, I'm
Yeah,
going to
please.
kind of segue on that, and think about it from a primary care standpoint. And I think, when you work in primary care, you see a lot of things that you could change in any practice field, really. But and I noticed in primary care, and one of the things I've told students, and I've told some of our colleagues that come to our nurse practitioner meetings is, take some of those things that you see are a problem in your practice that you could improve, and see if there's someone else also having those kind of problems in their practice. And you can connect together, and you could try to make a change, together. You could write a paper, you can do presentations. And sometimes when you take some of that information to the legislators, it makes a huge difference, because they really need to know what's going on at the practice site and why policy change is so important, because they really don't know. They're on a whole different level than you are, and they don't understand. I mean, you've got attorneys, you've got CPAs, you've got people who are just, decide they're going to run for the legislator, and they really don't understand the day-to-day workings in an office setting. And so sometimes if you can combine your thoughts with someone else who's having some of those issues, and you can connect, and you could maybe get 3 or 4 people that you notice are having some of those same problems, you can present some of that information to the legislators, because they really have to be educated, and they need to understand what goes on in practice. This and that bill for the pap smears under anesthesia was a perfect example of that. The legislators have no idea what that meant to a practice. So, here I am in my practice, because now it's in law, and I've got to have every single patient that I'm going to do a PAP on sign this document. I had to type up this whole document, make sure it sounded okay, tell my office now that they have to implement this. They're like, what is this about? This is ridiculous. And then, you have to explain to your patients, now, why do I have to sign this paper? You're just doing a pap smear on me. I mean, and then you have to educate your patients on why you're having to do this. Luckily now, that's been resolved, but I got to tell you, that was a huge thing in practice that legislators they voted for the bill, and they had no idea what they were voting for. They had no idea.
Sorry, Vicki, I was going to say, you think about how many times do you do a pelvic exam on someone in labor, right? So it was requiring informed consent with each exam.
Right.
It just went
with each exam. I mean, it just was out of control. And, yesterday I was on a call with our lobbyist, and there's a bill we have right now that it's just a horrific bill, and I can't even make head nor tails out of the bill. It's talking about something with the GME and this and that, and I'm like, well, that's all medicine, that has nothing pertaining to do this. So we couldn't figure this bill out, and we went to the staff, and you know what it was? There's a dermatologist who doesn't even work with nurse practitioners. He's trying to strip nurse practitioners of everything. And he's got this bill in that we cannot have and he stood in front of the legislator yesterday, told them we have no board certifications as nurse practitioners, that we are not board certified, number one. And number two, this bill is the fact that if I'm a family nurse practitioner, I can't be called a family nurse practitioner. It's a felony. If I'm a pediatric nurse practitioner, I can't be called a pediatric nurse practitioner. It's a felony. I can only be called a nurse practitioner in the state of Florida. I can't designate my title of my education, which the thing's never going to pass through the Senate because we have friends in the Senate that are not going to allow it to move. But that's a very classic example of someone trying to put something through. The legislators say, okay, he's a dermatologist. He really knows what's going on with the nurse practitioners in Florida, but he doesn't work with any. And why would you strip someone of their licensure? First of all, it's required licensure in Florida to be board certified. So, you know, taking a lot of these things that you have in practice and educating the lay people, and I call them the lay people legislators because that's what they are until you educate them, is critical. It's critical to your practice.
I'll just piggyback on what you said, and it's so true. You have to educate the legislators because they need to make informed decisions, and they're counting on you as the person testifying. And it's not just nurses and doctors. There are people from the community, people that have had personal experiences with some of these bills that get up and testify. So you want to make sure you're giving them the best information, the most current information, so that they can make educated decisions. And you're right, you have some physicians that try to tear nurses down, especially nurse practitioners, because they feel that you're treading into their practice, just as we feel that some other specialties like to tread into our practice. For example, you had veterinarian assistants who want to be called veterinarian nurses, and we shot it down, you know, because they're not taking care of human beings. And so you have to, you know, you have to be cautious. You also have to work well together. But stand together in solidarity and don't let, you know, physicians such as that dermatologist that was mentioned come and try to take away from you what you know is right.
And I'd add to that, some of that, a lot of that work is really getting to know your representatives before you have legislation that you need them to vote for ahead of time. And I think specifically letting them know who you are, that's your constituent and what you do. Talk with them every session about where you practice and what your services are and what your role is and what your scope is and what your education is and what your expertise is. And let them know and invite them to reach out to you when there are health related or nursing related or advanced practice related. In our case, we ask every time there's a maternity care bill, if there's anything related to maternal health or anything related to midwifery, to think of us as the experts that they can call. We had our lobby day today. I'm driving back from Richmond. I'm parked so I can join you all. And when I went in to see my legislator, he's been there for 2 years now. You know, and we walked in and I said hello, and you know, I'm masked, and I reintroduced myself, and he said, "Oh, I know who you are." I said, I told my aide, I said, Katie Page is coming in. She's gonna tell me what I need to know. She's gonna let me know. And they remember you, you know, good or bad. But we have that relationship because I sought him out when he first got elected to office, and then have continued to maintain relationship and call them and send them information about bills. So establishing those relationships and nurturing that is really key, to also allow you to speak truth to the utter lies that are presented about our care. It's baffling.
It is baffling.
You know the saying, like, keep your friends close and your enemies closer, and keep your legislators close. I have all of my senators and delegates in my phone, and I text them, I call them constantly and let them know, like, this is what bill needs to be talked about. You know, this is what bill we need to put into play. So I totally agree. And they know when you're coming, you know, and they know who you are and what you stand for. So I agree wholeheartedly.
You know, when we visited our senator who has this bill for this physician yesterday, our lobbyist went to her and said, you know, do you know what this bill means? And she said, yeah, I know what it means. She said, tell me what it means. And she told her something completely out of line. And she said, that's not what this means. And this is a legislator, this is a senator who worked for a lobbyist firm for nurse practitioners that was hired by the Florida Nurses Association. And so she knows all of our issues. And she said, do you realize this is stripping the nurse practitioners of their title? And she said, no, that's not what this bill is. She had no idea what this bill was. And she said, well, I'm not letting it move the floor. I'm not letting it move the floor. She didn't know what it even was, but she put this bill in. So, you know, you have to keep on top of it. And that's why it's so important that you have people in your lobbyists and stuff, that you've engaged those lobbyists, because they go through those bills with a fine-tooth comb, and they will put, I remember one time, Barbara Lumpkin was standing in the Capitol with me, and where she was going through a bill and reading it, and she found a clause in the middle of some other bill that was just completely, God must have been standing down from her and saying, look at this bill, because why she pulled it, we never will know. And it was to strip us away of all of our privileges completely, 100%, taking everything away and putting us under the Board of Medicine. And she caught it and went right to the legislator and said, do you realize this is in your bill? And he said, no, I did not, Barbara. And he pulled it out. We would have been stripped of everything. So it's so important for them to be involved and for you to be letting them know what, you know, what your issues are. I can't even stress that enough.
Wow. So tell me, because we're coming to the end of our time together. It has just flown by, but tell me, what can we all do, whether we are, so like, I don't have any legislators in my phone. I'm not like Melanie. I don't have all the important people in my phone. I've never visited my state, Capitol building, which is a horrible thing to announce on a recorded video. I am a full-time employed, well, I work for Frontier, and then I also do clinical practice, but we're talking to a whole group of people who are strapped for time, and soon they will be, they won't at least be students, but what do we do? How do we start?
Email. You start with an email. Email is like, I think of, is like the easiest, it's your gateway to lobbying. It's just to send an email. We send them all day long. So some of the easiest ways are if you are being a member of your organization, be a member of your state professional organization, your national professional organization, because when your lobbyists or when your legislative representatives and your teams are following bills, and there's a bill, an action item that comes up that you need to contact your legislators about, you get an action alert and you click a link, and the link fills an email, and you click send. And congratulations, you have just participated in advocating. You have just lobbied your representative, and you did something you do every day. You clicked a button on a computer. And then the next step is to make a phone call. And say, or write a letter. You handwrite a letter. Your next step is to handwrite a letter. And you handwrite a letter and say, congratulations on your election. And you put your business card in. And then maybe the next step is you make a phone call, and your first visit to your legislator's office or to their aide, meet with the aide first.
Yeah.
She says, what's a handwritten letter? You get some cool stationery. Don't say what's stationery. And then you take a friend. Your first visit, you always take a friend, and it should be either someone who's never done it or someone who's done it before, and you just go. I was telling my colleagues today, I've been going to the Capitol for the last 6 years, and today was the first day that I did not feel that nervous-sided sort of tension in the morning of like, what am I going to say, and what if I stumble my words, and what I forget, and today was the first day in 6 years that I walked in and was like, we know what we're here to talk about. You're the expert. So
The other thing I think also is when your legislators are back home and they're out of the Capitol and they're back home in your districts, that's a really good time to get their ear, because they're away from all of the drama. They're away from all of their colleagues that are trying to, instill different thoughts in their mind. And so you have an opportunity to visit their aides and visit them in their local offices and really get to know them. And, if you know someone who is rerunning for election or something, get involved with their campaign. Offer to walk door to door. I remember when my daughter was in nurse practitioner school and she had to visit a legislator and do some work with the legislator. And I called Senator Nan Rich and said, my daughter, and I knew her so well, I worked her campaigns, I knocked on doors for her. And I said, my daughter needs to do some clinical hours in legislative. And she said, have her over here. And she spent 2 months with her and she learned a lot that way. But visiting them in the local area is really huge. And I will say, and I know everyone on this call that's on the panel will say this, you need to hang up from this call and find out who your local nurse practitioner and state organization is, pay the money and sign up and become involved with those organizations, because they are the ones that are working for you, and you can't do it alone. We can't do it alone. This takes a village. There's no way in Florida, this bill for autonomous practice, and even for our controlled substances in 2017, which we fought for, would have passed without a village helping us. And that's the village of all your peers. So getting into your local group and then expanding also to your state group and going to those meetings and connecting, and all of us who work with the legislative arena will be more than happy to mentor anyone. And that's, I think, the most important thing. And I saw somebody I think put in the chat, join your local organizations. It's worth every dollar that you spend to do that.
This is Melanie. I was going to add to that and say, besides, call your delegate or your senator's offices right now because of COVID to see if they're allowing visitors. And if they are, you can show up at their offices. Even as a regular citizen, they're there working for you. And so I don't know if a lot of you knew, but did you know that they handle issues for you? If you're having issues with the gas company, if you're having the school, you can go to your local, to your delegate or your senator's office to ask them to help you to rectify those issues. Also, they offer scholarships. If you have children that are going to school, the senators and delegates get money to give away scholarship monies to students. So sign your children up for those scholarships. Volunteer to be a part of what they're doing. I'm on a scholarship committee. The way I met my senator, who is our now senator, he was door knocking during his campaign, and he happened to stumble upon my doorstep, and I told him who I was and began working with him in his campaign and door knocking. And so go for it. Just be the change that you want to see. Use your expertise because they're looking for that help. They might even say, may I have your phone number? Reach out to them. And I'm just going to share an example. I recently received a citation from my senator. You probably can't see it, but it's a citation for my immeasurable impact on the profession of nursing in Maryland. And you are truly an everyday hero who works to protect your community. So they want to see that you have a vested interest in making a difference in your community, and they will be your cheerleader just like you'll be their cheerleader. So all the things that the ladies before me have said, it's true. Get involved, go for it. Don't be afraid to use your voice for the voiceless. And if you join ANA, American Nurses Association, is attached to your state association usually. So you pay one fee, you get the benefit of being with both. And then you can go to Hill Day, where we go on Capitol Hill and do lobbying and meet with your state, your federal representatives.
Well, thank you so much. I don't know, Suzanne, if you have anything else that you want to, we are past time, but if you want to finish us off with something inspiring.
And no one has left the building. Like, we're still going strong. Oh my God, something inspiring. All right, no pressure. I just want to echo what everyone else has said. And also to, as much as we'll go and ask legislators what they can do for us. I think that, Vicki mentioned it too, and Katie mentioned, you know, the idea about the relationship. There's a give and take, and we have a lot that we can offer them. And I think putting ourselves out there, like going door to door is so much fun. I know I am a freak, but it's so much fun to go and talk to people in your community and get to know your neighbors. And when they see you out there, you know, leveraging our, you know, we're the most trusted profession, right? Leveraging that trust to help our lawmakers, the ones that are our champions, get into office is huge. So I think, you know, just to reiterate what I said earlier, we have power. Don't let it go. Don't give it up. I know somebody else said it way more wisely. I think it was Toni Morrison, but like, we've got this. So, and no one, like I said before, no one's coming to save us. So it's on us, and we can do this. Thank you.
Well, thank you to all of our panelists. People have been sharing great websites in the chat, great resources. I feel like I know I am excited about health policy after this, and I can see lots of excitement with all of our students. This really has been a fantastic event, and I want to thank all of our panelists for sharing your knowledge and your experience and your enthusiasm with us. We really are truly grateful. And thank you to all 90, I think it was 99 people in the room at one point in time. Thank you to everyone who came out tonight to join us for this event. I really hope that this has ignited a spirit of I can't even think of the word right now, but I think has really just lit a fire in us, and that we all might answer that call and go out and participate in some, just even in a small way, in health policy in our own community. So thank you to everyone, all of our DNP students for using this as their bonus opportunity. Please remember to take your pictures, submit them to the Dropbox. But thank you to our panelists, and have a wonderful evening, everyone.
Thank you. And if anyone wants to join Maryland Nurses Association for a legislative night out, it's on the 21st of February, and I put the link in the chat. It's virtual.
Welcome to Maryland. Why not?
It's virtual.
Oh,
It's virtual.
I wanted to have a night out.
I know.
Thank you, everyone. Good night.